Welcome to the Absolute Podcast.
Well, thank you very much. Pleasure being here.
No problem. I actually was going to start the intro of you. I don't know. I was going to do it kind of comedic where you're going to like take a toothbrush and pretend to brush my teeth. But I didn't know how that works. So I kind of just forgot until now, but I thought it would be funny. So
Well, maybe we'll wait till we have the coffee. We can get the stains off afterwards.
yeah, exactly. Yeah, there's some whitening going on. So some people know it as cavities. Some people know it as the tooth fairy.
Yeah.
Some know it as dentures.
Yeah.
You're a dentist.
Correct.
Yeah.
Yes.
And your whole life.
Well, not my whole life, but the last 24, 25 years, yes.
Wow. That's crazy. That is crazy.
Yeah.
Is there anything you wanted to be outside of being a dentist? Like that were in the thoughts?
Yeah, my route to dentistry, I guess, is a little bit convoluted. I started off in engineering at UNB for a single day, and like literally a single day, and realized after the first day of classes this is not what I wanted to do. So got into just a science degree, biology. That's kind of just a general catch-all for people who don't really know exactly what they want to do, but they know they want to be in health sciences to some degree. And yeah, I sort of went right through the gamut. I started thinking I'd like to be in medicine, and then pharmacy, and thought about veterinary medicine, and went through all of those, and they weren't clicking. And then finally I thought, well, why not dentistry? And basically it was kind of the last option on the table, and turned out to be the best one.
Right on.
Yeah.
That's crazy.
Yeah.
So there's two types of dentists. Like dentistry, you can go into like dental surgeon, right? Like
Mhm.
a DDS, is that what it's considered?
Right. Yeah.
And then a DDM or DMD? What is
Well, there's two official degrees a general dentist can have. One is a DDS, that stands for Doctor of Dental Surgery. The other is a DMD, that stands for Doctor of Medical Dentistry. And it just depends on which school you go to. Essentially, it's the same thing. You're still licensed to do the same procedures. At Dalhousie, they have a DDS, okay? And I think Saskatchewan maybe has a DMD. And it just depends on which school you attend. But once you graduate, you're licensed to do a certain amount of procedures, but then you can specialize after that if you want to go into orthodontics, that's braces, endodontics, that's root canal specialty, periodontics, that's gum and bone. The pinnacle of dentistry would be what we call an OMFS, that's an oral and maxillofacial surgeon. And that's an extra, 1, 2, 3, 4, 5 years, I think, on top of an already 8-year career to become a dentist. Wow. So, but when you're an oral and maxillofacial surgeon, you're rearranging jaws, you're removing, large cancerous tumors. You're also a medical doctor at the same time. So you're a dentist and a doctor. Right. And a specialist. Wow. So yeah, they're the heavy hitters of dentistry for sure. Yeah.
They're top notch around here.
Yeah, that's right.
That's crazy.
Yeah.
I was reading on something called like special care dentistry, where it's like, I believe people with special needs.
Yes.
Or extra care, basically.
Yeah.
Whether they have like a disability or like they're in a wheelchair or even messed up facial structure.
Right.
I didn't realize that was a thing until I started kind of looking into what goes involved with dentistry.
Right.
Very neat. And does that take us extra like process of learning? And
I'm not sure exactly what you're speaking of. I know that there's a certain program called Operation Smile. I don't know if you've run across that or not.
Heard that.
But generally that's some of those surgeons that we spoke of, and some general dentists and nurses, and they will go to underprivileged countries, and they will actually repair a lot of cleft lips.
Right.
And
my
palates.
My grandfather, that's the only charity he donates to, actually.
Is that right?
He said he hates seeing kids born like that. So
Operation is very unfortunate, and they do some great work. I mean, it's fantastic, the stuff they do. I'm humbled even now when I see these guys and what they can do. And filling teeth is one thing, root canals and extractions, but when you see these guys that are changing lives and rearranging faces, it's very, very humbling to know that some of these guys in my profession can do that. So so there's that. And I mean, there's your general special needs patients that I try to treat as many special needs folks in my office as I can. But there comes a point where you may not get the cooperation you need, and they have to be referred to, specialists that would have nitrous oxide sedation, or possibly have to go to the OR for IV sedation, tap in the arm, just so you could get the compliance and the cooperation to get the work done.
Yeah.
Yeah.
So I'm interested, how limited are you towards, like, do you have to send people to a specialist sometimes based on...
Yeah, it depends on the situation. I do a little of most specialties. I don't do braces. That's something that I didn't really get into. Certainly I was taught to do it, but when I got into private practice, I was so busy I didn't touch orthodontic treatment. We have orthodontists for a reason, I believe. And I tend to refer all of my braces cases to full-fledged orthodontists.
Nice.
But to answer your question, when you graduate from dental school, you can do a little of whatever you want. If you want to do root canals, you can do as much or as little as you're comfortable doing, but you're still held to the same standard as a root canal specialist if your root canal were to fail. Okay, it's the same thing as oral surgery. You can take out as many wisdom teeth as you want, but you better not get in over your head. If you know what's good for you, you have to be sure you're comfortable doing the job that you're doing. Again, that's why we have specialists. I tend to do lots of root canals. The ones I'm concerned about, I will refer. I do plenty of wisdom teeth, but the ones that are laying sideways in the bone and are covered up by skin and you can't even see, those are the ones I tend to refer. They're difficult to remove.
Do you know about blood and...
Oh, that doesn't bother me.
Oh, okay.
Yeah, listen, if every single patient, but I shouldn't, well, whatever, it's the truth. But every single patient that comes in, there's going to be some little bit of bleeding, whether or not it's from the pinprick of the needle or putting that old rubber dam on. So you've got to be used to blood.
Yeah, exactly.
Early on.
Yeah.
If you're faint of heart for blood, don't be a dentist.
Right. Or medical field in general.
No, that's right.
You're going to have to deal with that at some point.
Yeah, that's right.
No, it's very neat. Decision making sounds like a little bit of a part of that process.
Yeah.
And can you get arrogant and being like, no, I could do this? Or...
Oh, yeah. I mean, I don't think you're going to find a dentist anywhere who hasn't tackled something that maybe they shouldn't have, maybe overestimating their abilities, maybe not having enough experience to know what should be referred and what shouldn't. I certainly won't lie. I've had my share of teeth that I thought I could remove easily and broke off a root and you have to go digging. There have been times where I've overestimated, the curvature of a tooth with a root canal, thinking it was straighter than it was, and then you're into a mess because your files can't negotiate the curve. So there's all kinds of instances where judgment comes into play, but most of that comes with experience.
Right.
You can sort of, I pretty much know now, as soon as I look at an x-ray or as soon as I look at a tooth with the mouth, I'll know what I'm capable of and what I'm not.
Right.
Yeah.
And that comes with just 25 years of being a dentist.
That's right.
No, it's very cool. Has dentistry and being a dentist changed the way you kind of run your life in a sense? Like, or were you, like, did it make you a certain person? Does that make sense? Kind of more philosophical, but...
Yeah. I guess there are,
like, do you have to change your mindset towards things and like your attitude towards things? And change kind of how you should be as a person in the workplace?
Certain ways, yeah. I don't know if this answers your question, but when you deal with the public 24/7, at the end of the week, I found that I'm a little more introverted than I used to be. And I'm not sure if this answers your question or not, but at the end of the week, you just want to go, okay, no more dentistry, no more, less more chit chat. I just want to go in my little cocoon for a day or two, recuperate, rejuvenate, and then get ready to hit the chair again on Monday morning. So from that perspective, it's changed me a little bit in terms of how outgoing I've been through the years. Not that I'm a total recluse, but at the same time, I do like my private time.
Right.
You certainly become a bit more conscientious. It's tough. Dentistry is an expensive business, and you'll see folks that come to the office who don't have insurance or have a limited amount of insurance that they have to spend and thousands of dollars of work that needs to be done.
And you learn to sympathize certainly with some of these folks, and it's easy to forget that a lot of us have more than others. And there's a fair bit of free dentistry that I do, or discounted dentistry, just because it's just the right thing to do. You feel better about doing it. I know where my next meal is coming from, so if I can help somebody else out that's in need, how much of a person can do something like that. So,
Exactly.
yeah.
And you're privately owned.
Yeah, I own my
Right.
practice.
So could you get away with that under a corporation or a name?
Yeah, well, I how do I put this? It's kind of a convoluted thing, but I have my own professional corporation,
Okay.
and also a numbered company that sort of owns the building and the property. But yeah, I'm sort of running my own ship right now. My corporation has shares. It's a weird structure. I'd have to get my accountant here to explain. I don't even understand it all. But no, it's different setting up today, I think, than it used to be. I sort of hung up my own shingle and built a patient base, and before I knew it, I was up and running, and my chair was full. It's a little bit more concerning to do that today because the price of setting up apparatus with the equipment is astronomical today compared to when I did it.
I read up on some numbers. I never believed numbers online because you can never tell. Yeah, they were up there. Just to get started.
Scary. To get started is insane. Even just to get to dental school is crazy. Like, I remember my first year, tuition plus instruments plus. First year I was looking at about 22 grand, I think, for my first year of dental school.
Where did you go to dental school?
Dow.
Okay.
And so every year after that was a little bit less expensive, but still, 14, 16, 18 grand. And now, I just spoke to a guy who's just gone through his first year of dental school. He's a patient of mine. And he said that his first year, compared to my 20 grand, his first year was 70 grand. Yeah,
70 grand.
Wow, I was not expecting that number jump. I was thinking like 30 grand. Like, you know what I mean? Like,
yeah, well, the first year is always the most expensive because you have to buy all of your equipment to work with.
Your own equipment?
Yeah, well, some of it's provided for you. Back when I was there, the drills were provided and the instruments were provided, but you had to buy those funny glasses. We call them loupes. The loupes you had to buy, and certain instruments for the lab you had to buy, Bunsen burners and this and that. But everything is just skyrocketed. So it's a lot different trying to get into dentistry and set up today compared to when I set up.
Right.
Yeah, I set up at the right time. I was lucky.
Yeah, very good. It's the same as any franchise, right? Like trying to start a franchise, all the numbers have doubled, like tripled, just trying to get a location. Oh, man.
Nothing gets cheaper.
Right, which is strange.
Yeah.
And then how far can you keep going like that?
Yeah.
Until there's like 4 humans left.
Exactly. No,
yeah, it's strange. It's weird how that works. Yeah, you definitely have to take consideration in others. I did read about that, where dentistry, there's something weird about money where it's, like you said, it's an expensive like maintenance for your body, I guess. Or I was going to say, I don't know what the word I was looking for, but...
Well, I'd like to interject there for a second, and I can't stress this enough. It doesn't have to be expensive. I mean, a toothbrush and a thing of floss is not that expensive. And I tell this to anybody that comes in, I do sympathize with the cost. But, taking care of your teeth is not an expensive proposition. Brushing and flossing,
twice a day.
Well, you should be brushing twice a day anyway. Okay, morning and night, just to get the junk off. When you wake up in the morning, you've always got that gross old film on your teeth. You want to get rid of that. That's just a bacterial layer, if you can imagine that.
Isn't that crazy? In 7 hours of nothing, it just...
Yeah, that's exactly
cakes
right.
right up.
That's how they multiply, right? Or, of course, when you go to bed at night, there's food and there's crap and there's crud and everything between your teeth. So you take care of that. You floss that out of there every day and brush twice a day. And chances are pretty good there's always going to be a little bit of maintenance as time goes on, little you can get small cavities into the grooves of your teeth that the toothbrush can't get. But by and large, you're going to avoid a whole lot of money, a whole lot of time in my chair. I don't want to say pain. I'd like to think I'm relatively painless, but a whole lot of discomfort, okay, both in your pocketbook and in your mouth if you just take better care of your teeth. So, and I would like to, for anybody who's listening out there, I would impress upon you, you can stay out of that chair as long as you look after things.
Yep.
Yeah.
And that's why you provide them with the baggie of goodies every time they leave.
No excuses.
Right.
No excuses.
Yeah.
If we give you the tools, okay,
Right.
you got to use them.
Exactly.
Yeah.
Do you brush and then floss, or do you floss then brush? Because I used to brush and then floss.
Yeah.
But now I floss and then brush.
Yeah, I never really thought too much about that, but I think maybe it would be wiser to floss first, because you will get all of that junk out of there, loosen it up,
Right.
and then you can go ahead and brush it all away. I guess that would be my...
Or brush, floss, brush.
That'd be even better. And we're leaving out a critical component too, which is rinsing. Okay, with Listerine. I hope no Scope representatives are listening, but I wouldn't waste my money on Scope. Listerine is the most potent antibacterial killer you can get, and if you can handle that gold stuff, it tastes like battery acid, but it will kill every bug within a half a mile radius.
Really?
It's just like a nuke in there. Yeah.
Wow.
Yeah.
What was the big problem one time? Like alcohol was in those?
Well, yeah, any mouth rinse that contains alcohol can dry out your tissues. So, dry mouth is not something that you want. It's that sort of predisposes you to more decay. So it's wise to try to find alcohol-free mouth rinses if you can. Yeah, but that's not a huge issue. It's not a big one.
Yeah.
Yeah.
You might think I'm crazy, but I've not used toothpaste in like months. And it's actually felt like my teeth have gotten stronger, almost.
Yeah.
And like, I don't know, like they just stayed a consistent color
Right.
the whole time, instead of just kind of fluctuating all the time. I don't know, I just haven't used it for a while. Nothing against toothpaste.
Right.
I just found I wanted to try just brushing with water, hot and cold or whatever.
Well, I'm going to call you partially crazy. Okay. I'm not going to call you full-blown crazy.
Okay, perfect.
Listen, to be honest with you, all toothpaste it's an abrasive paste, okay, with fine little particles in there of abrasive. And that will you can certainly keep your teeth clean without toothpaste. It's, the mechanical action is probably responsible for 90 to 95% of plaque removal. That's just a number I'm making up.
Right.
But pastes, the abrasive in pastes, okay, that's what actually takes care of some of the stuff you can't get at. That gets you your extra 10%.
Oh, okay.
And certainly when you add fluoride to the mix, a fluoridated toothpaste, fluoride will help sort of incorporate that mineral back into the tooth structure to make it a little bit harder. So if you're starting to lose a little bit of your tooth structure, if you're missing areas and you have these little chalky white spots, those are called decalcifications. Fluoride in toothpaste will help sort of reharden or remineralize those little chalky areas.
Very cool.
So that's why you need the toothpaste.
All right. Maybe I'll do a little bit of both.
Yeah, but don't. And again, this is my own, my own personal opinion on this. But don't get blown away by all these advertisements for whiter teeth and fresher breath and this, that, and the other thing. When you boil it all down, toothpaste is just a mild abrasive that helps clean the plaque off your teeth. It's, people who spend extra money for whitening toothpaste, it may have that much difference, but it's not going to make a huge difference.
Like my favorite toothpaste that I'd use, even though I haven't used it for a couple months, just because I wanted to try it. I don't know. Maybe it's a bad experience or experiment, but 3D Crest was my favorite, but it probably, like you said, it doesn't make any difference.
Yeah.
Really.
I'm trying to think, is it the 3D stuff that almost tastes a little bit hot when you have it? Or is that...
I don't think
I just stick with good old Colgate. There's my dentist's secret.
Sure.
But I have Paula, my wife, she's brought home some different stuff from time to time. Yes, dentists do have to buy their own toothpaste at the drugstore.
They don't get supplied.
Yeah, and I'm trying to think. There's one that she brought home. I'm pretty sure it was a version of Colgate. There's 3 or 4 different versions, or more than 3 or 4. Anyway, one almost was a little bit hot, and I found it worked really well.
Exactly.
Yeah, maybe it was just the heat in there, or just that little difference in temperature. Yeah, it
Very
felt like a
interesting.
little hot tamale in there.
Yeah.
Yeah, it was good.
Children's toothpaste.
Yes.
Any difference?
Not really. I have this question fairly often from moms that are a little bit concerned about extra fluoride. First of all, if you live in a fluoridated water source, like Sussex, they have fluoride in their water, the town water.
Is that considered like hard water? With that stuff in it, or?
Well, no. I'm talking about like the municipal water sources.
Okay.
There's fluoride added to the water.
Sure.
Just to make sure there's some in the water. Okay, so you don't, you get some sources of fluoride if you're A, on a municipal water source, B, from a lot of foods that you drink, foods that you eat and liquids that you drink. Bottled water, they all have a little bit of fluoride in them as well. But what you really have to be careful of is well water. Okay, if you're on a well, you sort of need to take periodic samples of that water to make sure you're not too high in fluoride or too low in fluoride. Because either way it can, either way you can have damage to your teeth. Yeah.
Wow. Too much fluoride would what? Just break it away?
Well, you can get fluorosis. Okay, that's like a lot of fluoride can be incorporated into the tooth, and you can have little spots and little bands and whatnot. And not enough fluoride. Well, you can have chalky teeth there, and a little bit more prone to flaking and disintegrating a little bit. So you got to be careful with your fluoride.
Yeah.
Yeah, but you can get your water tested fairly easily to figure out where you're at and what you need to do.
So I was talking to someone one time, I think it was a teacher back in like grade 10, and they said that they're just like really prone to getting cavities. Like, no, she's healthy, she was drinking like 2 liters of water every day, like avoided sugar and still got cavities.
Right.
Is some people just prone to get cavities naturally?
Well, the first thing I'd like to find out from this lady is whether or not she was an avid flosser. Because again, I know, listen, it's the simplest thing when you start talking about dentistry and hygiene, but flossing is going to eliminate the majority of cavities.
Right.
That being said, there's a number of different factors that can contribute to more cavities than an average person would get. One would be dry mouth, one would be diet, one would be bacterial composition in the mouth. There's all kinds of different factors that will factor into how easily or how prone a person is to getting cavities. I see brothers and sisters that will come in, and the brother or the sister will have a perfect checkup time after time after time after time, and yet the sibling living in the same house, under the same conditions, everything being equal, 2 cavities this checkup, another cavity that checkup, 2 more this checkup. So
Crazy.
Yeah, so it's not fair.
No, that's not fair.
But it's multifactorial. There's all kinds of different things that lead to whether or not you're prone to decay or not.
Right.
Yeah.
Like Mark Fleming said, if you floss, 95% of that can be resolved.
Yeah, that's right.
I just lost my train of thought. What was I thinking? Oh, Mom, for me, her biggest worry was like my gum swelling.
Yeah.
Like she always worried about like, let me check her teeth, and she'd pull my lip up and she'd be making sure my gums weren't like pushing over my teeth and stuff.
Right.
What is that? I don't even...
Well, you can get overgrowth of the gums. The fancy term for that is gingival hyperplasia. Hyper meaning more, and plasia basically meaning tissue. Okay, so excess or more tissue. There's different reasons for that as well. If, again, your mouth is dried out and you're a mouth breather, some people are vertical growers and they basically walk around with their mouths open most of the time. If that happens, you can sort of dry out your tissues quite severely and your gums will swell. Another part of that equation is whether or not you're on certain medications like anti-epileptic medications like Dilantin, nifedipines. That will cause overgrowth as well. And oral hygiene as well. Okay, a lot of swelling of the gum tissue just comes from inadequate oral hygiene and keeping things clean. So I'm trying to think back to you whether or not you were back when you were a kid, whether or not you were keeping things nice and clean or not. You've had your share of fillings.
I've had one filling.
I think it's Connor. I should be telling stories.
Connor was a sweet tooth man.
Yeah, for anybody listening, I'm supposed to be professional here and not talk about patients on camera, but
no, we have a mutual friendship here, so we're allowed to get away with certain things.
Doctor-patient confidentiality shot here right now.
Yeah. No, Connor was a big sweet tooth. Mom had to make sure. I was never a fan of junk food. Not a big dessert eater, never was. And I've only had one. You can probably look at my files. I think I've only had one filling.
Yeah, I'd have to look back.
Yeah.
I must be getting you confused with Connor. It must be Connor.
No, I know Connor's had at least like a couple or a few, sorry.
Yeah.
I know for a fact, but...
So if you're listening, Connor, we're throwing you under the bus here. Your brother's throwing you under the bus just to get out of trouble here.
Yeah. But we can, if we film a video together, we can bring those up and see the proof. See who's telling the truth now.
That's right. Yeah, that's right.
Yeah, I don't know why Mom was always concerned with my gums, but she always made sure they weren't red, they weren't puffy, they weren't falling over my teeth type thing, and I never understood why that was an issue.
Well, a severe case of that can be a little bit off-putting. I mean, the teeth look to be half the size because basically the gums are growing over. And I don't know, maybe she saw somebody else's kid along the way and just said, I got to keep checking this boy, make sure things don't happen to him. Yeah, I would, but it's relatively uncommon. I'd say maybe 5% or less of the patients that I would see would have gingival overgrowth. Yeah.
Very cool.
Yeah, not common.
No.
Yeah.
So I remember last time I was at the dentist with you, talking to the dental hygienist, I said, what's the nastiest thing you've dealt with in their mouth? And I was going to ask you what that was, but you wouldn't really deal with many dirty mouths, would you?
Oh.
Or do you still deal with that?
Oh, yeah. I mean, I would say probably my chair would be, it's tough. It's tough. There's a lot of folks who, unfortunately, for lack of funds or maybe lack of education, lack of motivation, there's a number of different reasons why some folks don't get dental care, and I've seen some pretty severe cases of just wall-to-wall decay, wall-to-wall rotten teeth. I've taken out, one gentleman, he came in and he didn't have one solid tooth in his mouth, not one. And this is a long time ago when I first started. I don't think I would do this today. Probably within my first 5 years of private practice. And the poor gentleman, he had absolutely nothing left that I could save. Just everything was mowed off completely at the gum line. Abscesses everywhere. So we made the decision.
Abscesses being just
infection,
almost like pimples on the...
That's exactly right.
Okay.
Little pus bubbles, pus bubbles. So the poor guy, we wound up putting him on an antibiotic for a few weeks, and we brought him back, and we made the agreement that we were going to pull his teeth and go ahead and make him a couple of dentures. And there are 32 teeth in the human mouth, and I took 32 teeth out of that gentleman in one sitting. And like I say, I'm not proud of that, okay? And that's something that today I would probably do if necessary, but maybe not in one sitting. He was adamant that he wanted the whole thing done, and I was a young buck and thought, okay, let's get this done for this gentleman. And it went fine. Everything was great. But at the same time, it was a lot for him and a lot for me. And so I probably wouldn't do that now. What we generally do if we have to have a denture made and there are no teeth that are savable or salvageable, we'll extract the back teeth and we'll let those heal for a month or two, and then we can get started on the denture work by taking impressions. Okay. So after a couple of months, we've got the back areas that are healed, then we start taking impressions, and then we can actually have the denture made here in one hand, and then you can extract the remaining teeth and then put the denture in on the same day. Now, they don't fit very well. Okay, that's one of the limitations of immediate dentures, the type of denture I'm talking about. But you can retrofit or refit these guys every so often as the situation dictates, and you can sort of tighten them up a little bit as time goes on.
Very cool.
But one of the cool things that we do today that's becoming more and more popular all the time is implant-supported dentures. Most upper dentures fit pretty good because they're like almost like a suction cup.
I was going to say
those darts? The darts you had when you were a kid. You'd stick them in the window, lick them and stick them.
Same as the roof.
Yeah, that's right. And so the palate serves as the window, okay? and then the denture serves as the dart. All right, so when you push up on the plate, you squirt all the air out, and then you can give a little tug, and you'll get some suction. The lowers, you do not have that luxury. There is no seal. So for a complete lower plate, if you can't secure a partial plate to existing teeth, and all the bottom teeth have to go, the lower plate rocks and rolls and does not stay in place. And I make them, but I warn every patient I see, this is not ideal. And so what we like to do now is to place a couple of implants down into the corners where the two eye teeth would be, and then we can make a plate that will clip down over top of those two implants, and that's much, much more stable. The unfortunate part is it's much, much more expensive.
Yeah.
So to have an implant supported lower denture made, you're looking at somewhere around between $600 and $6,500 for a lower plate.
Wow.
Which is a lot of money.
And what's the process getting that on and off? Like
click, click,
it just kind of pops. Oh. Okay.
Yep, you can actually hear it go pop, pop, and it comes off.
Very cool.
So you clean everything, and then you can put it back in. Yeah.
I wonder how many people ignore their dentures.
Ignore them?
Yeah, just like don't clean
Leave them in?
Yeah.
More than I'd like.
Really?
Yeah. Yeah, you need to take them out, because if you don't, you can get infections basically underneath the plates.
I was going to say, there's always that little bit of gap, and that'd be nasty.
If you want another nasty story,
I do.
All the viewers out there, this is kind of, might be time to go get a sandwich or something, because this is a gross one.
Yeah.
When I was in dental school, we had part of our rotations, we had to go to different rotations. We had to go to the VG to watch oral surgery. You had to go to a couple of pediatric rotations, at schools. You had to work on children to get your feet wet, just to, kind of break the ice and learn the trade. But one of the things we had was in geriatric dentistry, where we had to go to a convent that was adjacent to Mount St. Vincent University in Halifax. And unfortunately, I sort of inherited a patient. She was probably in her late 80s, early 90s, and she was a nun at the convent. And she had had a denture made for her by a previous dental student a year and a half or so prior. And she couldn't take care of herself very well. She was non-communicative. She couldn't really speak well or feed herself or whatever. And unfortunately, after the dental student made the denture, nobody had helped her clean it or take it out or look after it or anything. And it was an ill-fitting plate that didn't fit very well. And what had happened was that the gums had grown up and basically over the plate.
No way.
And we could not. I had my instructor come over, and I said, I don't know what to do here. I don't even know how to get this out to clean it. And so he was a seasoned dentist too, and he wasn't even sure.
Wow.
He looked at the situation, and he wasn't even sure what we were supposed to do. So we wound up we pulled and could not get this thing out. It was locked in. And
do you know the time period that it had to grow?
About a year and a half. Like, no one had ever taken it out for her or helped her clean it. It was very unfortunate. Wow. I think some knuckles were wrapped at dental school because there was no continuing care for that patient. A lot of times, dental students are in a rush to get all their criteria and out the door. And unfortunately, some of these folks, if they can't advocate or communicate for themselves, they sort of get put on the back burner. But fortunately, the dentist that we had on staff, he was really trying to improve upon the program at the time. And anyway, this poor lady, we had to anesthetize her. We had to remove some gum tissue, and then we had to basically take the denture out, and she had to leave it out for a couple of weeks to let things heal. Yeah. And then we had to try to refit it. It was.
So what does your mouth look like?
A mess.
Really?
Just yeah. I think there were a few teeth that were not repairable at that point. They had to go. We had to retrofit the plate, and it was.
So does she have to pay for this, or is that like on the school type?
No, I don't think so. There might have been a small thing that maybe the convent paid for. I really don't know the ins and outs. I don't remember that part. But I don't think there was a big fee charged to her. But she'd suffered enough.
Good. What is the material you guys use to fix a chipped tooth? Tooth cuts in half.
Yep.
You got to add a new piece.
Yep.
What kind of?
Well, it's basically called composite or composite resin. Okay, and it's basically plastic.
Is that, composite's like that's a plastic?
Yeah.
Oh, composite, like toe composite. You know, steel toes or composite toes.
Yeah, sort of
what I mean?
like that. Yeah.
I was thinking of cement for some reason. I don't know why, but
Yeah, no, there's no cement involved, but it's basically a hard resin plastic, I guess is the best way to put it. If you're going to ask me the chemistry, I would have known back in dental school. I do not remember anymore.
yeah.
But anyway, it's basically what you do is you shape the tooth the way you want to. You can put in little undercuts if there's not much to bond to or glue to. You can sort of mechanically lock in a few little preparations, and then you basically coat the tooth with glue, and you activate the glue, and then you butter on white composite resin, and that's just filling material. And so then once that's on, you harden that, then you shape it, you smooth it, you check the bite, you polish it. And then you let the patient go and you pray that it doesn't break off again.
There you
because I'm actually really surprised that more fillings don't fracture, because all they really are little tiny pieces of plastic held onto the tooth by a thin layer of glue.
Right.
Yeah. So if it's a big enough fracture, you may want to progress to what we call a porcelain crown. And what a crown is you take the remaining tooth structure and you drill around the whole thing. Okay, you take some.
Oh, that's when the tooth just turns into a little tiny white nub.
That's
almost.
right. Yeah, it's kind of like I say stump. That's kind of
Stump.
I'm lessening the procedure, but it looks like a stump.
Yep.
And then what you do is you take a mold of that stump, and you can do one of two things. I have in my office, a lot of offices it's becoming common, but my office has what's called a CEREC machine. It's almost like a 3D printing machine, and you can print out a tooth through a computer and a wireless milling machine. You can print out a tooth that you can cement right over top of the stump. It's almost like a thimble that would go over your thumb.
Okay.
Or the old school way of doing it is taking impressions or molds and you send that to the laboratory and they will send you back a perfect tooth that will go over the stump.
Right on.
The advantage of the laboratory is that if there are little nuances or shades or, you want to get the color just perfect to match the one next to it, the lab can do a really good job at that. But this milling machine that I have, it's basically just a uniform color, one color.
Right.
So it's great for back teeth, not so great for front teeth.
Because you'll
Yeah. You can get really, you can go down a rabbit hole with this stuff, and you can get into staining and glazing and all this crazy artistic stuff. But the time you'd take to do it, you'd have to charge a lot more for the crown. So usually we let the lab do it, and there's not much of an extra cost involved. So
right on.
Yeah,
That's cool.
Yeah,
It's crazy that there's laboratory workers that are just molding teeth. That's so crazy.
Yeah, well, they hate the CEREC machine because it's really chomped into their work, right? The CEREC machine is so convenient, just simply because it's sort of a one-shot visit. You don't have to bring the patient back a second time and anesthetize them and put on this crown that came back from the lab. You can do it all in one shot with this milling machine.
Yeah.
Yeah, so it's pretty cool.
That is cool.
Yeah, I often think the first dentists were blacksmiths and farriers and barbers. Okay, the horseshoers and barbers and blacksmiths, and I think of what their dentistry was 150 years ago.
I was talking to somebody about that.
Yeah.
Wasn't it just like remove? There was no
most of the time.
Right. It's like, you got a sore? We'll get rid of it.
That's it. Yeah, and if you don't know which tooth it is, we'll take the one ahead of it and the one behind it too. And so there were a lot of people running around without teeth 150 years ago.
Yeah.
And the dentures were very, very rudimentary. Yeah.
Yeah.
They were nothing special.
I don't know what would they use back then. Do you know? What kind of? Because I did. Sorry.
No, I was just going to say there's that old famous story about George Washington, and he had dentures made of wood. They were carved out of wood. How he got them to stay in his mouth, I don't know. Excuse me.
Just a little bit of glue.
Yeah. I don't know what they did, or a couple of wood screws or something.
Yeah.
I don't know. Early implants, right?
Yeah.
And I mean, they moved from wood. I think they got a little fancier. They got into a little bit of ivory. Then they get into porcelain. They made porcelain dentures for a long, long time, right up until basically I graduated from dental school. And porcelain's beautiful. It looks really good, like really, really nice. But the problem with porcelain dentures is that porcelain is, it's a little bit harder than enamel. So if you have natural teeth on the bottom and you have a porcelain upper denture, your denture is going to win, and you're going to wear your lower teeth down.
Yeah.
So the other problem is if you have porcelain on porcelain, you've always heard that joke about dentures clacking and making a lot of noise. They're terribly noisy, porcelain on porcelain. So now we basically make dentures out of plastic, and it's not it's
more
not
like
nearly
just like
as noisy.
I don't know. Yeah.
Yeah, just doesn't have the snap to it.
Yeah, exactly.
The clicking and the clacking.
Yeah. I was reading a little bit on dentistry, on like the history of it, and apparently it's considered one of the first practices of like medical.
Yeah.
But I'm guessing just because they probably just took a rock to their mouth and just like trying to get rid of something.
Yeah.
But then I was thinking, the advancements of dentistry really weren't that crazy until like, what, 100 years ago? Where they really...
Yeah. I mean...
I could be wrong.
No, you're probably right. My history of dentistry is a little foggy and a little hazy, but I know the advancements in the last, 15 to 20 years. I'm not a rookie anymore. I'm kind of turning into one of the old guys now. And just even the way I did things when I came out of dental school, it was all cutting edge, right? And now I look at what I did 20 years ago and I think, wow, well, we do things so much differently,
Yeah.
I guess 25 years.
I was going to ask you, when something new or new innovation comes into dentistry, how do you learn? How do you
we
get
have
updated?
CE courses. We have continuing education courses that we go to, and a lot of them are vendors and companies that are plugging their products. And you've got to be very careful because everybody tells you that your practice will not survive without this technology. Without this laser, without this CEREC machine, without all that stuff, right?
Right.
You all right? Yeah.
I'm gonna make it. Sorry.
That's okay. Yeah. You all right?
I'm good.
Okay.
I think.
Yeah.
I'm trying.
So anyway, you got to be careful because you've always got these guys trying to sell you. Okay. And I hope there's no dental salesmen out there listening too, because a lot of times you have to sort of sift through the BS and really know what your practice needs without breaking the bank for the latest, greatest piece of equipment that you really don't need. I bought a laser a few years ago because I thought I really, really needed it. And I've used it maybe a dozen times in a year and a half, I would say.
Wow. What was the advantage of the laser?
Well, the laser really helps if you need to get at a cavity that's way down into the gum and you can't even see the bottom of it. A laser is great to just go ahead and zip the gum off so you can actually access the cavity because it actually cauterizes as it cuts.
Very cool.
Yeah, it's pretty neat. But again, the number of times I've used it, I thought maybe I'd be using it every second day. And this stuff's expensive too. People wonder why dentistry is so expensive. The cost of running a dental clinic is astronomical. Most clinics run at about 55% overhead. So every dollar you make, 55% goes to overhead, which would be, rent and staff and, heat and lights and equipment costs and insurance and you name it.
Yeah, I looked into what dentistry, and I don't know if this is a sore topic, like getting the money type thing, but it was like if a dentist is doing good, they can take about 30% revenue back to themselves. Yeah. If they can get it good, because sometimes it's not available to be 40-30%. That's what it was saying, but I don't know.
Well, like I say, your expenses are usually between a crazily efficient practice would run at about 50%, but I don't know too many. I mean, you're really scrimping if you're going to run your practice at 50%. So 55% is more the norm. 55, 60 is a little high, but basically that means every dollar that you bill, 55 cents of that would go to overhead, and then 45 cents would go to the dentist, and of course Revenue Canada gets half of that. So so it's it's expensive to run a clinic.
Yes, it is.
And so the unfortunate part is too, that all gets passed on to the customer as well. I mean, I look at a little bottle of Bond. It's glue, and it's no bigger than this, like literally that big and that big around. and you're looking at anywhere between $200 and $250 just for that little bottle of glue.
How long would a little bottle like that last? Or how many patients, I guess?
Depends on how many fillings you do. Yeah, I don't know exactly, but I know it goes a lot quicker than I'd like.
Yeah. It's like every week I got to buy a new bottle.
Yeah, that's right. That's right.
But it's one of those things like needles, for an example. Those are expensive just to get the needle for things, not just dentistry, but like just the medical field in general for hospitals. And just to think that every little piece. Yeah. Because is it biomedical? Is that like engineering? Like, is that what they're building? Medical procedures, tools and stuff? Is that what that is?
Biomedical engineering? You're stretching my knowledge of what biomedical engineering is.
I'm not too sure. But to think that how much advancement they need to do just to create tools for the human body. Yeah. Like there's a lot of factors going into this. So.
Oh yeah, there's no question.
It's crazy. Yeah, it's wild.
It is a shame for sure. Yeah.
Oh, this was a question I had. Is there anything the same material as a tooth in any other part of the body?
No.
Tooth is...
No.
Oh, cool.
Enamel's the hardest substance in the human body, and it's extremely unique. And again, I'd have to go back to my old histology from way back in 1995. But yeah, it's unique. There's no other substance like it in the human body. Bones are not as strong. And the unfortunate part is it's incredibly strong, but at the same time, if you catch it the wrong way, it shears fairly easily. So I'm not sure how to explain that any better, but super, super strong, but if you catch it the wrong way, it could break. Right. And that sounds contradictory, but... No. Yeah.
Makes sense. I mean, it's like your arm is really strong, but if you like hit it straight on with something, it's just going to shatter up.
That's right.
There's nothing to...
Yeah. Exactly. Yeah.
Very cool.
But no, enamel's very unique. It's the funny part about enamel is too. There's not a nerve ending in enamel, so there's three parts to a tooth. The outside portion is the enamel.
I was going to say the hard part that you can see.
It's the hard part that you can see, and I could lay you on that table and get out my drill and drill right into your enamel, and you're not going to feel a thing. But as soon as I get through your enamel, we get into the dentin, and the dentin. It's not really a nerve, but at the same time it has these little tubules that will go straight into the nerve, and when fluid moves through these tubules, it'll make the nerve sing. So when you get into the dentin, that's painful.
What's the point of the dentin?
The point of it?
Like
it's the bulk of the tooth.
Okay.
Yeah, it's the bulk of it.
See, when I was looking at the diagram, like the half tooth or whatever, I thought it was like the cushion part or something, like to absorb.
No cushion. Yeah.
Vibration or something. I don't know. I was just, that was my guess.
There's fluid in those tubules, and I guess you could sort of look at it as a bit of a cushion. But yeah, I guess if you look at it sort of like an egg, the shell's the enamel, and the clear white stuff would be your dentin, and then the yolk would be your nerve. Okay. When you get into that nerve, that's when you know you're alive. Yeah, it's very painful. Yeah, when you have I've seen a number of people through the years who have broken teeth off, and they'll come in with their nerves hanging out of their teeth. Oh, wow. Yeah, and
is it like stringy?
Yeah, it's like what. To be honest with you, it just looks like a little tiny worm is what it looks like. And sometimes when we do root canals, for these individuals that I've seen in the past, and they've been hit, and basically the nerves are hanging out of the teeth, you can actually get these little files for root canals, reach up inside the tooth, anesthetized, of course, and latch onto that little nerve and pull it out. And it will come out in one big piece on the end of your file, and it literally does look like a tiny little worm.
That's crazy.
Yeah.
Oh, that's nasty, but that's cool. That's what stuff actually doesn't really gross me out, but it's just to think that somebody's coming in, because I know somebody that they're running down a ramp of a work truck, had a big cart with them with a heavy load on it. I don't know why they were running, but they were young. Fell face first, smashed their 4 teeth out of their face. Man. And then he kept working like he was fine. He just had a lot of pain. Yeah. And then like police officers saw him, and they go, "Man, you're bleeding out of the mouth like crazy." And then they actually took him to the hospital, and I don't know. He must have had his nerves just hanging. Because is it hard for them to rip out nerves?
Nerves? What? Sorry, what do you mean? Is it hard for them to rip out?
Because if say you're to knock out your teeth,
yep,
would your nerves stay input?
You mean if your teeth came out completely?
Yeah.
So
Or
the
what-
nerve's inside the tooth.
Mm-hmm.
So it's hard to explain, but
I didn't know if it would crack all around it, you know what I mean? Before it would actually just kind of all
Well,
come in one piece type
that
thing.
would completely sever the nerve connection, because
Oh,
there's a
okay.
nerve that, if you picture like a front tooth, you know what a front tooth would look like. So there's a nerve that goes right up to the very end of the root, but then it's connected to a main nerve.
Okay. Like a main track.
That's exactly right. And so when you smash out a tooth, you've severed
Oh.
the blood supply and the nerve supply.
Okay.
And so a lot of people will have these teeth reimplanted into their mouths when they have a tooth knocked out. But the problem is the nerve isn't viable anymore because it's lost its blood supply. And varying degrees of success when you reimplant teeth. Some last, some don't. And then if you lose a tooth, well, then you're into either an implant or a bridge or a partial plate.
I've heard about a bridge.
Yeah.
And a bridge is just fake teeth connected together?
Well, what a bridge is, let's say you're missing your front tooth. Okay, remember how we talked about crowns before?
Yeah.
You do a crown on either side of the missing tooth, and then the lab would fabricate you a little 3-unit bridge.
I did see a picture of that, yeah.
That would come in and cement over top of the 2 pegs with the false tooth in the middle.
Very cool.
Yeah, and they stay in place, but
And you can't floss it because...
you can't floss it 'cause it's all one piece.
It's all
so it'd be
connected.
good for you because you don't like to floss.
Hey, not that I don't like to floss. No, you're mistaking me for Connor. You're
For Connor
Yeah.
again.
Yeah.
Here you go, throwing
Yeah.
your brother under the bus
Yeah.
again.
I'm going to send him this podcast and say, hey, you better listen to this. Yeah. Text his girlfriend, hey, is he flossing tonight?
That's right. But no, you're correct. You can't floss between it because it's all one piece. Yeah.
Right.
Same with a denture too. You can't really. Well, why would you? I mean, you're not going to get cavities on denture teeth.
Exactly.
Yeah.
Advantages of being a private-owned
Yeah.
dentist is...
Yeah.
Would you say it's better or worse, or just it depends what you're looking for type?
I would
Answer.
say there are huge advantages, and I would also say there are huge disadvantages. Because
Pros and cons. Let's go.
Pros and cons. Pros of being your own boss. You set your own hours. You work as much or as little as you'd like.
But if you're good, you do a lot.
Well, yeah. I mean, it depends on whether you want to retire early or whether you just want to cruise along and work till you're 70 or whatever it is you want to do. Personally, I don't think I'd want my dentist to have bifocals and come in with a cane. I think there is a certain point where you need to give it up and hand it over to the next generation.
Yeah.
But that being said, lots of life left in these bones at least. But the pros of having your own business, you call your own shots. You don't have to argue with partners over what kind of filling material are we going to use, or hey, you're using too much electricity, or there's none of that. It's you're your own boss. You call your own shots, work your own hours, take vacation when you want. Have a closer relationship with your staff.
I was going to say it's nice because some doctors that aren't in their own clinic can't have like a crew of dental hygienists with them, right? Like a steady crew.
Sorry, you say...
So if you're working like under a name in a building,
right,
as a single dentist, you're not always going to have dental hygienists by your side.
It depends on the building. Sometimes you'll have your regulars. Sometimes your staff will be your staff and they work with you. Every moment that you work, they work too.
Okay.
And then other times it's a shared pool of hygienists that in a bigger clinic or a bigger office, they will sort of fill in whoever really needs an extra hygienist or whoever is really busy or wants extra hours or whatever. Okay. Yeah. So, I mean, the disadvantages, I'd say the pros outweigh the cons, but as a solo practitioner, it would be nice to have partners to bounce ideas off of from time to time.
I feel like, it'd be kind of tough being solo all the time.
Yeah, it can be. Yeah, but, I have enough friends and colleagues that if I needed to ask them a question, it's a quick phone call and we can discuss the case and move on. But it's still nice to have somebody sitting right across from you and you can look at the x-ray together, and so there's that. Another thing being a solo practitioner is it's hard to have somebody cover your emergency calls.
Right.
I guess I understand it. People expect, doctors and dentists and lawyers and certain professions are held to a higher standard. And we're expected to be on call 24/7, 365, but we have lives too. And sometimes you feel guilty taking a vacation because you're just hoping and praying that the patient base that you have, they're not going to have a toothache or have an accident or whatever where they need your services and you're not around.
Right.
So it can be a guilty feeling when you take a vacation and you're just wondering what's going to await you, on a Monday morning when you get back type thing.
Mm-hmm.
Yeah.
So if you're taking vacation, do your staff take vacation?
Yep. Yeah.
Really? So if you took a week off, the whole building's done for a week type thing?
Yeah.
Oh,
yeah.
very cool.
So we usually, the way it works at our office, or the way it has worked in the past, is basically we tell them a week that we'd like to have in the summer. And they tell us a week they'd like to have in the summer, and we usually kind of run them together so we have a nice long break. But we're very, very flexible with vacations. I don't think I've ever denied a staff member time off
Very
for
nice.
any time they ever needed it, whether it was just for a vacation or.
He's a good boss.
Well, depends on who you ask. I'm glad my staff's not here. They might say otherwise.
Yeah.
Tough to say. But no, you have to keep your staff happy in order for the office to be productive and for everybody to get along. And if you were to ask me what the biggest strength of my practice was, I would have to say it would be my staff.
Right.
Everybody gets along really well.
Right.
They get along great. They cover for each other. I've been very lucky through the years with great staff. I've got a lot of long-term staff that have been there a long time. And I guess it makes me feel good to think that they'd want to stick around long enough to hang in there with me over 18 years. We'll be open, I think 18 years this May, 2005. Yeah, 18 years, 2005 to 2023.
Right on.
Yeah, that's right.
That's so crazy.
Yeah, it is crazy. I felt like a young guy for a long time, and then somewhere the hair went, the beard went gray, and the wrinkles came. And I was like, man, where'd that come from? I wasn't watching closely enough, I don't think.
I think I saw a photo of you when you were younger coming into the dentist. I don't know, maybe if it was me or just maybe it was a photo of you.
Yeah.
But it was from years ago, and I was like, man, he looks so not in a bad way. Like,
Well, I had a mullet in high school. I had a big perm in the 80s with a mullet. That was great.
Wow.
I grew up in Petty, where your worth was judged by the perfection of the mullet that you grew. Yeah.
Nice.
Yeah. I did pretty good. Mine was fake though. Like I say, mine was a permed mullet. This is the 80s. Remember, Magnum PI was a rage and perms were big.
Yeah. They started to make a comeback for a little bit.
Perms?
A year ago, yeah.
Yeah, really?
A lot of people were doing
No,
it. Oh.
they should do away with
Did
those.
get away with them?
They should.
Stick to bald?
What's that?
Stick to bald?
Stick to bald. Yeah, I went bald in my, I guess not bald, but I started losing my hair, I would say, in my early 20s, early to mid. And luckily I had my wife locked in by that point, so it wasn't as big a deal to me as it probably was to a lot of guys. And I tried to hang on to it for years with limited success. And the funny story goes, the very first time I shaved my head, I was cutting my grass. We used to live out in Meredith Drive in Sussex Corner, and it was a hot summer day. And I came in for a glass of water partway through, and I caught a glimpse of myself, and I just had this old stringy hair, and I tried to comb it to the side, and it just looked horrible. It was hanging down here in the front. And I said, enough of this. I'm done with this. So I went in and I got the clippers, and I said to my wife, will you please shave my head? I'm tired of this mess.
Nice.
She said, no way will I shave your head. So I plugged in the razor, and I took one big swipe. I went zzz, and then I handed her back the razor, and I said, will you shave it for me now?
It's too late, yeah.
She said no.
Wow.
I had to go get her sister to trim it up for me.
Dang.
Yeah. So
But now you don't have to worry about the morning routine.
No,
like
I spend about $1.55 in shampoo for an entire year. It's fantastic.
Yeah.
There really are advantages to this. You may not think so.
No,
You've
I
got a
believe
good head
it.
of hair. You're
Yeah.
lucky, but trust me, there are advantages to this when you get.
I believe it. Time management is spectacular.
I'm in the shower for about 35 seconds in the morning,
Yeah.
in and out,
Yeah.
just like that.
Drying it's literally just a dap.
Yeah. The worst part is my wife and my kids, they put me in the poorhouse with hair care products and what do they call it? Ombre coloring. Ombre? I don't know. I've heard that word kicked around my house a bunch of times, ombre. So anyway, between haircuts and ombres and highlights and all, the money I save on this is completely out the door on those guys. So it all evens out, I guess.
Ladies and gentlemen, everybody has to go bald.
Yeah, I wouldn't recommend it, but if you have to, it's not so bad.
Yeah, no, I believe it's good. I don't think I'm in luck for having a full head of hair my whole life either. So
No?
I don't think so.
Well, you're doing pretty good for your age.
Yeah, it looks good.
Yeah.
21, not too bad.
Yeah, me at your age, it wasn't pretty. No.
I know somebody that was like 18, like they were graduating high school, and I took their hat off. I don't know why I ripped their hat off, but like half head. And I was like, no way. And he like got embarrassed and threw it back on. I kind of felt bad.
That's tough,
That's
man.
crazy.
Yeah.
Yeah.
So anybody listening out there, don't bother trying to hide it. Just get rid of it.
Just embrace
keep it short.
Yeah.
Yeah. Most people have a pretty good head for being bald. Most people. Some people have the egg heads, but
Yeah.
I was pretty lucky. I think my head's fairly well shaped. So
No, it's good. It's a good roundness. It's got a good structure.
that's right.
And when in doubt, put a Pittsburgh Steeler hat on.
Yeah. Oh, yeah. Exactly. That makes everything look better.
Right.
That's right.
I don't know if I can totally agree with that, but right now you're on the podcast, so yeah, they're great.
That's right.
Fun fact, guys, Mark used to razzle me every time I was in that chair, and I was scared I wasn't going to end up too well after.
You're lucky I just didn't put the pressure on you. Pledge your allegiance to Pittsburgh, or you're getting 4 cavities at this checkup.
Yeah.
Yeah,
That's great.
that'd be unethical, though. I'd probably do it to you now, though.
Yeah.
And I did see your Green Bay sticker over there. It ruined the whole wall.
Oh, great.
Yeah, your fans at home can't see it, but
I know.
Yeah.
I was going to wear my slippers, but I said, oh, I better not.
Now that wall needs to be repainted now.
Do you still have your football room?
I do.
Nice.
Yeah. I have a room over my garage that's dedicated entirely to the Pittsburgh Steelers. A little bit of a sickness, but I've been a Steelers fan since probably about 2003-ish, I would say. It was Roethlisberger's first year, so I think that would be 2005. Yeah.
I think Aaron Rodgers' first year was 2005 as well.
Yeah. I think that was when I started. Yeah.
Very cool.
Yeah.
Were you always into football?
No, I was a basketball guy. I played, of course, my height. I played basketball up in Petitcodiac. We won 3 provincial titles back in high school, which doesn't sound like much because we were single A, but we kicked everybody in the province from Sussex to FHS to Moncton High to Trimble. They were a powerhouse back in the day. The only team we lost to, we only played them once in the 3 years I played, and the only New Brunswick team we lost to KV once, and we lost to St. Stephen once. Yeah, anyway, back to your question. Football. No, I was usually a basketball guy, but a roommate of mine at UNB got me into football. He was a Raiders fan, and I couldn't help but watch it because he always had it on Sunday. And there was a Jerome Bettis commercial where Bettis stood at the top of a hill and he looked down and it said training day. And he just kind of looked at the camera and shrugged his shoulders and threw himself off the hill, and he bounced off a bunch of boulders and smashed himself around. He got up and shook himself off. And he turned around and ran back up the hill to do it again.
That's funny.
And I found out Bettis played with the Steelers, and that's kind of where it all took off for me. I thought that was pretty tough.
That is pretty tough. That's funny. Jerome Bettis who was known as the boss on the
That's
Steelers?
Bettis.
That is Bettis? Okay.
Bettis.
Because he just ran over people.
Yeah.
Like, no question.
Oh, I don't have it. I'll show you after. But he's probably Jack Lambert, Joe Green, and Jerome Bettis would be my top 3 favorite Steelers. And my wife and my daughter and my daughter's boyfriend got me a cameo. Have you ever heard of those cameo things that some of the old sports players used to do?
Yes.
So they got me a cameo from Jerome Bettis where he actually sent me a message and said, "Hey, Mark, I hear you have me on your wall." And
you can answer it if you want.
That's all right. So, no, anyway, Bettis, he kind of connected with me and not with me, but just sent me the cameo. And it was so cool because my wife had kind of given him information to read, and he was reading off a sheet, of course, but it was still really cool to have the bus talking to me. So.
That is awesome.
That's pretty cool.
Just to recognize you and show his appreciation, and
that's
cool.
right.
Very neat.
Yeah.
I always like kind of more emotional, but when like cancer kids kind of have like a wish type thing, and then
Yeah.
nicer when they go visit them. But if they can send them a video and they're like, hey, like we're fighting for you, like I hope everything's well, like that's so cool. I find that
100%.
amazing.
And a lot of those athletes, a lot of those guys are sort of the prima donnas, and like Antonio Brown, for instance. Brown was a favorite of mine, but I don't think you would find him do much for anybody in that sort of situation. But there are a lot of really, really good athletes out there who do so much that goes unheralded or quietly go about their business. They don't want the recognition,
Right.
but sometimes it slips out, and they're almost embarrassed that they've been found out, right? But yeah, so toy drives at Christmas. A lot of these guys do toy drives. And
Thanksgiving's huge for the States.
huge, and
So-
they, they'll buy 500 kids, a pair of sneakers and give a football jersey. So many times you see athletes go visit kids that are in the hospital, like you said, that might be dying of cancer or whatever. So they're still good in the world.
Right. No, there is. There's dentists that give you a good deal on teeth if you.
That's right.
No, very unique. What else are you into besides football, basketball, teeth?
What
saw
else
it-
am I into?
Well, you came in with flops and you drew a wave on the.
Oh
board.
yeah, well I've got a gigantic love for Hawaii. My wife and I have been there a few times now, and that sort of stemmed from my my love for this guitar player. Maybe love's too strong a word, but my mini obsession with a guy named Jack Johnson. I don't know if you've heard of Jack Johnson or not
I
before.
don't know. Pretty basic name. But...
Yeah. He's just a laid back surfer dude, and just makes some really good music. And he's been around for quite a while, but he's I guess he's mainstream, but just under the radar a little bit, we'll say. Anyway, he got me into guitar, and I just wanted to sort of emulate a few of the songs that he played. And so I went out and got myself a guitar and taught myself to play. Randy Curry helped me along the way. I don't know if you know Randy.
No,
or not.
I don't.
Randy's a great local guitarist here. He's a great teacher, gives great lessons. And so between me fumbling my way through and some lessons from Randy, I can play for the dog now, and she doesn't howl anymore. So
Nice.
yeah,
Very good.
My wife still does, but the dog doesn't.
That's fun.
So that, and I guess I do a little trail building in behind our place. We live up by the bluff, and there's a local landowner by the name of Harley Hunt. I think everybody probably would know Harley, and Harley's been very generous with his land.
Yeah. Because that's a massive tourist attraction now.
Yeah, it is. Now, Harley doesn't own all the way to the bluff, but he does own a significant way into the bluff, and he's given us the thumbs up and the green light to build trails. I used to do a lot of mountain bike riding, but when you gain X number of pounds, I switched from that to trail building. And so there's a little run out there called Maze Run that it took me about, I guess, a year and a half or so to cut out and build.
Yeah,
and...
I've biked it a few times.
Oh, have you?
Oh, yeah.
Okay, cool, yeah.
Mark,
So-
I do a little bit of everything, so you name it, I've done it. Except for working on teeth.
There you go. Yeah. So anyway, that Maze Run was named after my dog, May.
Very cool.
In case you're wondering what that.
Now I can tell people. Do you know why this is called the Maze Run?
That's right.
That's
Yeah.
awesome.
Yeah.
Because did Maze Run go like this?
Yes.
Okay.
Yeah. So it's off. There's a double track that goes out to the bluff, and you got to be looking fairly carefully. But on the left-hand side, there's a little side trail, and it's about I think it's close to 3K. And and so you can get a lot done with a rake and a set of loppers and a chainsaw.
Yeah. Was it
Yeah.
just you? Would you go it solo? Or would you go with the crew?
Pretty much me. A few times a few guys chipped in and helped out, but I find that you were asking, I guess in dentistry you need a little peace and quiet sometimes, and that's a perfect spot for me, is out in the woods, because nobody can get to you out there.
I feel like as a man, like just going out in the woods, working alone on some trees.
Yeah.
It's perfect. It's perfect.
Who's that guy on Parks and Recreation? What was his name? Get your inner, what's his name there? The guy with the big mustache.
Oh, I
Did
don't
you watch
know.
that show?
No, I don't think so. I've heard of it. I've
What's
heard of
his
it.
name? Anyway, some of your viewers might know, but yeah, channel my inner guy out there anyway.
Inner guy. Yeah.
Yeah, but it's really fun because it's cool because you turn nothing into something. And the deer are kind of the real heroes out there because they sort of find the path of least resistance, and you can sort of follow the deer path and you can just widen that and limit, and
That's awesome.
yeah, nature will find its way, and as long as you follow, you'll have something in the end. So
That's sweet.
yeah. Anyway, so between that and guitar, and I coach basketball. I coach a lot of minor basketball here in town, and I serve on a few volunteer committees, I guess. So
Right on.
yeah,
Man of community.
well, I don't know, debatable, I guess.
Yeah.
Yeah.
Hey, you're doing your part. That's all that matters.
Yeah,
You're doing a little
right
bit
on.
of your part.
Right on. Yeah.
So cool.
Yeah.
Very cool. Do you have any questions for me?
Let me think.
I never asked anybody that, so you're the first.
You're on the hot seat, are you?
I guess so. This is
What do
scary.
you foresee this turning into someday?
I foresee this someday that I will be able to go to Hawaii and Jack Johnson will be there playing while I'm setting up these cameras and I can have a conversation with him.
You may interview him.
Yeah.
Very good. Is this something that you'd like to turn into a full-time gig someday?
Yes, absolutely.
Yeah.
The goal, while I'm young, it's a great way to see the world if I can do it right.
Mm-hmm.
Oh, camera turned off.
Look at that! Just when you were getting your
I know.
your 15 minutes of fame.
My goal, if I'm being quite honest, I've never spoke about it before, is to work with, I've always dreamed of working with National Geographic, and the reason why I'm pointing is that's the National Geographic book
Right on.
right there. So
Cool.
working with them because they have unlimited amounts of information, knowledge,
Resources.
resources, interesting people, and it's an excuse to see the world. I think the main goal of it is to inspire kids to do stuff, but I want to make interesting videos with, for an example, you, as well as a podcast, so people can get true detailed information, as well as something entertaining that they know that's coming. So it's like, no way, like Mark Fleming and then Mitchell Jones and Mark Fleming are going to film a funny video together.
Cool.
Maybe like a little bit of information, but like mostly entertainment, but try to correlate both.
Right on.
Does that make sense?
It does, for sure.
It's just building a platform right now. It's just taking time, but the goal would be to travel, whether it's talking to Justin Trudeau, that's big stuff, or just talking to a local salmon studier, basically, or salmon researcher.
How do you pick your subjects? How do you pick your interviewees?
Well, I'm curious about anything, so if you're an expert at it, then I'm going to choose you. I mean, I like to know a little bit about the person, because if I personally know them, I don't really want like a dickhead on or something, but and I also don't want people just promoting stuff. Like,
Right.
If I want you on, I understand that, like, Dr. Mark Fleming, what's your
DDS.
DDS?
Oh, you mean my
No, yeah, like what's your company?
Fleming Family Dentistry?
Sure.
Yeah.
So that, like, obviously that comes with it,
Right.
but I don't want that to be the main premise. It's more just informational, entertaining. I wrote down on a piece of paper, like a vision board. Actually, that blue paper, do you see that?
Yeah.
It has everything that I want to try to accomplish.
Cool.
Receive, get, whether it's going to happen or not, that doesn't matter. But the goal would be to be as entertaining and as informational as possible. Through that, I'm going to try to build this through YouTube. I always wanted to try to do YouTube. If it doesn't work, then I'll go to school. But right now, I'm just trying to build this. So does that make sense?
It does make sense. And, I'll say to you, if you're living in the Sussex area, I don't think you've really made it until you're up on the wall here, up on your board, your wall of fame.
Mm-hmm. So basically, National Geographic and Red Bull, two dream companies of mine,
Yeah.
have very interesting and unique career paths that you can do. I mean, Red Bull's more like stunty and athletic type, and National Geographic's a lot of like cultural, worldly stuff, which is two super interesting things.
Yeah.
I think you can do so much with that and show people a world of just unique knowledge and
Exactly.
how they get into it, what they do. And I don't know, I like to learn about the person. Like, as much as I like to learn about teeth and the information that you provided, I also want to learn who Mark is.
A little bit behind the scenes.
Yeah, and build a connection. If I'm getting real honest, a dream of mine was, if I was lucky enough and fortunate to have kids someday, that through the connections that I build through this platform, I will be able to show them different avenues and different things when they're younger.
Cool.
And you can get paid to travel. I'm speaking a lot of stuff right now. I've never really...
I've opened up a can of worms, viewers.
Nobody's seen my game plan, but now my game plan's coming to life. No. Hopefully, if it gets big enough. I don't want to be famous, but what I'm doing has to deal with numbers and stuff, so I don't know. not that fame comes with that, but a following, I guess.
How have your numbers been?
Okay, not bad. Being from a small town and still growing. I mean, I'm in the 10th percentile of podcasts right now, which is cool.
Really?
Yeah.
Wow.
So that's pretty good.
That is pretty good.
But it doesn't take much. It's like only if you're over like 20 episodes, you can be in the 10th, and I'm on the 32nd episode. So it's not that crazy. To really grow, it's just going to take time.
Well, it would be tough to grow the brand a little bit, I guess, simply because any of the people that you are interviewing are just very local, right? So it's hard to expand. How are you going to get somebody in Toronto to be interested in what people in Sussex are doing?
Exactly.
Yeah, unless you...
But it's maybe not necessarily based on where they're located. It's more like what they do. And whether I'm in BC or Fredericton, it doesn't matter. It's just kind of... I mean, travel would be part of it just based on, I don't know, certain harbors in BC would deal with certain things, for an example, like boating and different stuff like that, than they would in Halifax. Does that make sense?
It does, yeah.
So location doesn't matter, but where am I trying to go with this? Yes, it is hard, but the reason why I think this can grow is with my YouTube channel. When I film a video with you, if I can make it entertaining enough that people will... a bigger audience, the podcast will grow with it. Does that make sense? Even though I started the podcast first, and I have like a good section of episodes, the videos will slowly come. So eventually what I'd want to do, Mark, like this is exactly what I'd want to do, is I'm filming a podcast with you. We spend an hour, 2 hours together having a good conversation, learn a bunch of stuff, and then the next day film a video together, and then I can keep going and keep going and keep going and keep going.
Well, the interesting part is if they catch your video on YouTube, they might be more inclined to tune into the podcast.
Exactly. That's the goal. You're hitting kind of 2 in 1.
Exactly. So, one feeds the other.
Right. So a lot of people have their podcast, and most people have a podcast due to who they were as a person. So like Mike Tyson, for an example, he has a podcast now. His name has a lot of weight.
Right.
So his podcast is very easily successful. I'm building a podcast from no weight behind my name. I'm just building a podcast, which is kind of hard to do. Does that make sense?
It does.
So yeah, it's very different.
I see you do your research. You had a lot of insightful questions there, which is really great.
Yeah. Well, I'm curious about everything. Sometimes I have to force myself to be curious. Like sometimes like, oh, do I need to really like look at dentistry? Like, am I going to be a dentist? But
exciting stuff, isn't it?
Well, actually, it is interesting. Once you just you force yourself to dive in. It's the same as like studying for school. It's like as much as you hate whatever you're learning, whether it's just business or as basic as that.
Right. If
you just commit yourself to study for those few hours, you can really get some insight on some stuff. And it's not like I'm diving into like chemical formulas on certain, I don't know.
Good, because I couldn't help you.
Certain gases that you're using for people. But yeah, that's kind of the avenue that I'm trying to go. Whether it's going to happen, I don't know. I think it is because it's a dream, and I'm very persistent, and it's harder for me to give up than it is to try. I always told people that. So.
Well, I wish you the best of luck in growing the brand.
Thank you. I appreciate it.
Okay, and I thank you very much. Thanks for having me.
Thank you. Appreciate it. Right on. Mark Fleming, everybody. Mark Fleming's family dentistry, located in Sussex. I don't know if you can take on more clients. You're probably...
Unfortunately not.
Yeah, he's booked up. But if you leave a nice set of flowers by the doorstep, he will gladly appreciate them. Thank you, Mark.
Tim's.
Yeah, Tim's Coffee and the staff. Don't forget, they're the backbone of the company right there.
Thanks very much.
Perfect. Thank you.
Thanks.
That was awesome.